Hi, I'm Lisa Prather, and welcome to The Voice of Health with our host, Dr. Robert Prather of the Prather Practice, where lives are changed every day through the natural approach to healthcare. We're talking today about the importance of history, exam, and diagnostics before you begin care, correct?
Absolutely. I consider that such a critical part. If you don't know what's going on, how do you treat? Mm-hmm. Matter of fact, I considered it so important that I actually got a diploma in internal diagnostics because the importance of really understanding the patient's case, to really have the feeling that I know exactly what's going on is very critical to me as a doctor.
And the diplomat that you got, explain that. It's
Sure.
a diplomat in the American Board, right?
Chiropractic internist. And as I started my my chiropractic profession, I realized that, though we had an excellent education, I really wanted to be able to get a lot more in depth in understanding that. So I took a 3-year postgraduate course in internal diagnostics, all the different aspects that was involved in that, and found that was extremely helpful and really improved the outcome for my patients. Mm-hmm. It was something difficult to do, but it was it was certainly well worth it, though.
Mm-hmm. Yeah, those trips, 1 weekend a month?
Right.
When we had 3 little ones.
Yes, you were a very patient wife. And I really didn't complain that much.
No, I knew it was important.
Right.
So have you ever been asked by a patient to treat them without a history, exam, or diagnosis?
I have. The majority of patients really want me to know, but I do have people who come in and say, I just want a treatment. I really don't want to go through all the rigmarole on that, and that always, raises a red flag for me. Mm-hmm. Because I say, well, how do I, really know what's going on, and will just a treatment, be effective? Is there something I'm missing? Is the treatment actually going to cause harm? I can think of several examples of situations where it would have been disastrous. I had a gentleman who came in and in terrible, terrible low back pain. He had been going to another chiropractor, and the chiropractor was on vacation, and he says, I just need, an adjustment for my back. And he came in, and I said, well, I'm going to need to examine you. And he says, I'm in a lot of pain. I'm busy.
Just get me out of pain.
Yeah, just get me out of pain, get me adjusted. Mm-hmm. I know what I'm doing. Mm-hmm. And I refused, and he almost left, and he says, I'm here. I give up. Mm-hmm. And come to find out, he had a aortic aneurysm about ready to burst.
Oh my gosh!
And any type of an adjustment, could have just kicked that off. Sent him down to the emergency room, and his emergency surgery, and saved his life. Mm-hmm. Just because I wasn't willing to take the shortcut.
Right.
And that's one example that I can think of. There was a young man who came in, and he had heard that I did really well, and he had actually been to, because he was having low back pain, mm-hmm. and he had been to his primary care, couple of, a quick check, med check type of place, mm-hmm. and had been to 3 other chiropractors. And he said, it's really flaring up. I just want an adjustment. And, I was doing some history. I was asking him quite a few questions. He was annoyed. But he started, I asked him, his bowel movements and mm-hmm. things like that. And
he goes, what does that have to do with my low back? Right?
And anyway, we did an exam, got some history from him that really raised up some red flags. And anyway, short story, long story made short, he wound up having colon cancer. And he was 28, and nobody suspected colon cancer.
Right.
But from the examination in his history and, checking out the back, I said, you don't have anything wrong with your back. It's coming from the bowels right in through here. And then I was getting the full story. Got him immediately over to the emergency room, and he had full-blown colon cancer. So, again, I don't really believe in taking shortcuts, and I've got story after story of that, that, not having the proper procedures. And there are, not only do I say that, but these are requirements to maintain our license, to, what is the standard of care, and the standard of care is designed for the protection of the patient. And the standard of care is basically the minimum of what you should do. And we definitely go beyond that, in our office on the minimum. And I just don't compromise on that.
Right. Have you had any patients leave?
I have had patients leave, that felt that they knew best. And it might have just been something easy, but I never take that chance. And, if this is a continuing type of problem, I'm looking for patients who really want to get well, not just a quick fix.
Good. Well, why would a patient want just a treatment instead of a thorough, history, exam, diagnostic? Well,
probably one of the things is time commitment. We're all very busy.
Rushed and busy.
Everybody talks about and we try to, one of the things that is very true is people have said, wow, it really takes a long time, to get through the whole procedures. But again, we want to be thorough, and your health is important. I had one woman come up, and she had made an appointment, and we had tried to explain to her how long, but she came up and said, I have a hair appointment. And I'm like, ma'am, we feel that you have something really serious going on that could risk your life. Your hair appointment really can wait. And it's
I have a hair appointment.
I have a hair appointment, or I have to get my nails done.
Or I need to take my dog to the vet. These animals are, people are taking care of their animals better than they're taking care of their own health.
Yeah, I had a patient that, I was actually had him on a special program, because they had so many health problems. And this woman came in and said, I can't, I won't be able to do this for a couple months until I catch up. And I mean, she had life-threatening condition. I said, well, what's happened? And she said, they found a tumor on my 13-year-old cat, and I spent $6,000. And her whole care wasn't, half of that. And I'm like,
you should have been a vet, honey.
I'm like, the cat's 13 years old. But yes, we've had people walk out, and you were talking about, you've got time commitment. One guy accused me of, you probably do the same thing on everybody, and you're just trying to get more money from me. And it's like, well, first off, no, we don't do the same thing on everybody. We hardly ever do the same thing on anybody.
Right.
And then second, it's these are the prices that we have aren't established by us. There's usual and customary fees that are across the board, and we accept those. So we have a third party company that actually designs out what we charge on a regular basis. So I said, and so these are normal customary things that should be done. We're not gouging it, and we're certainly the time that we spend on that. It's not. In other words, you can make more money just by getting people in and out. Do you know what I mean? It's opposite. The people who are interested in money time out how long it takes you to see someone, and charge it accordingly, and jack it up so that they can make the most amount of money per time. That's how you have to do it. Exams, histories, you don't time and money, you do not make money on those.
Mm-hmm.
The reason that you do those is because you're interested in patient care. If you're only interested in the money, then you get people in and out quick.
Yeah, and they want to rush through the paperwork when it comes to the history.
Right.
And we have to have them go back and answer the questions.
Right.
Yeah.
And all those things are actually important.
Mm-hmm.
Actually important. So, the whole thing of time and money, and, they don't understand. It's also a matter of not being comprehending of what we're trying to do.
And you said, it is required by your license, history exam, diagnostic. My license
Absolutely.
Also as an occupational therapist.
Absolutely. And
how do you know where you're going in treatment if you haven't done a thorough exam?
Right. The rules are there for the protection of the population, not for the protection of the doctor.
Mm-hmm.
It is there to protect people from people who are just interested in making money.
Yeah, and a lot of times, the stories you've already told, people come in with low back pain, but you found kidneys,
right.
The issue, by just palpating.
Sure, we found multiple myeloma in people. We found a tremendous amount of things, and then we also found out really how, even on a regular type of a case, what it takes to really get them well and keep them well. Mm-hmm. Because these are things that will age you and eventually kill you if you don't get them fixed.
Right. Well, up next, we'll be continuing to talk about the importance of the history exam and diagnostics. You can win a free 60-minute massage in a relaxing spa at the Prather practice. Each month, we have a drawing to give away a free massage to one of our lucky Facebook and Twitter fans. Follow us on Facebook and Twitter on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice. What conditions can be helped with acupuncture?
Well, of course, the sinusitis, tinnitus. We've had some very severe cases of that came in and had some excellent results. Toothache is excellent. PMS, menopausal symptoms. I have many women who are coming in saying, I've heard that it's excellent for hot flashes. Did some acupuncture, and they said, wow, I'm sold. Mm-hmm. Just because of the changes that occur with that. Headaches, migraines, acupuncture is an excellent adjunctive to that. Parkinson's disease. I have patients who are coming in with Parkinson's.
Oh, yes. Yes.
And actually getting some very excellent results.
You can see their gait gets better.
Sure. There are certain points that we do that are specifically have been shown to be very effective for Parkinson's. I know the National Institute of Health is doing some research on that right now with some very excellent results. I've gotten the points from their research that they've done, started to implement them, and I have definitely found that that's been extremely helpful. Mm-hmm. Stroke. Post-stroke, we can get some very good results on that. Mm-hmm. Cancer patients. A very interesting study that they did on people who were going through chemo radiation, that they had 80% fewer complaints if they were doing acupuncture. Mm. So
when they were going through
it. Also afterwards, there are problems with the nervous system afterwards. All addictions, cigarette smoking, we have a lot of people coming in for that, but acupuncture, specifically working on also some ear points along with that, along with the needle points on the body, actually can have some very, very significant improvement on really almost any addiction. I have a patient who came in just to try acupuncture, was actually in law school, and a lot of stress, a lot of things involved with that. And he just keeps on coming in because he says, I do so much better in school. I'm able to concentrate better, I'm able to relax, it just makes such a difference. There was a gal, whenever she was going through the whole CPA program, to get certified. And every time she takes tests, she comes in for acupuncture.
Before the test or
Yeah,
after?
she says it's better than Valium, just kind of keep everything nice and calm, and I can think great.
Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope. You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, the most comprehensive wellness center in the Midwest. We're talking today about the importance of the history exam in diagnostics. And Dr. Prather, it's interesting, the stories, you were telling, and people want to just skip that. And
Well, one of the things is that there are some clinics that are out there that they've, eliminated those things because they found that they do annoy people, and you can make more money by not doing it. And I am getting people in who have gone to see them, and there usually is almost always things that are missed, in the whole treatment program. So, that this is and something that has been adopted, has put out there, and you need to have someone who's really watching your care. The quick type of fix, especially within chiropractic, when you're doing most people are going in for pain. Pain is a warning sign. Just trying to get the pain under control, whether it's through medication or adjustment or anything, without really finding out what's going on, the reason behind it. I mean, you definitely want to get the pain under control, but you need to find the underlying reason. In other words, it's a warning sign. And just because you turned off the alarm bell doesn't mean the problem's gone. So, it's a concept that the reason that we're doing this show is that this is a concept that has been put out there, and it's something that is going on, and I feel very strongly that this is not a good trend.
Yeah, and just, your thorough schooling with the diplomat in the internal diagnostics, prepared you to do a thorough exam.
Sure.
And, let's talk about the importance of a thorough history. Why take a history on a patient?
Very brilliant people who I was privileged to learn from, so that you're going to get 90% of what's going on from the history. So a good history that can tell you 90% of and then you do the examination to confirm what you found in the history. But the history is really where you're going to get the basis of your care from. So getting that thorough history, all the different components of that, and understanding, not only the physicality of it, but also the emotional portion, where the patient's coming from, how to relate to them. The history designs out the basis of your care, and any time that history is skipped, there's going to be a failure in care. And one of the biggest problems that patients relate to me is that they feel that they aren't being listened to.
Yeah, we hear that a lot.
And we really try to make sure that we have that taken care of within our office, is that the patient is listened to, because there are so many times that the key to their care, the success of their care, is completely from the history that the patient gives me. And then that cuts through and gets me to the core of the problem much, much quicker than if that had been skipped.
And where is the history done in your office?
Well, one of the things is if you get them into the exam room and try to get the history in there, people, kind of a sterile environment they need to be, and it's kind of strange. And people,
ours isn't sterile, though. We got
no,
beautifully colored walls.
Well, no. That's the exam room. I
right.
said.
Yeah.
What we do is we take our history in a nice, almost like a living room type area.
Right.
Where people feel comfortable. They're sitting in a couch, familiarity helps people to relax, and if people are relaxed, then they can relate better.
If they're comfortable, yeah.
If they're comfortable. So as we're doing the history, we try to make sure that the patient isn't in a gown, sitting on an exam table, and people poking and prodding on them.
Yeah.
What we try to do is get it in a nice, comfortable area that people are familiar with and relaxed and can enjoy themselves, and then be able to, oh, yes, I remember this. Mm-hmm. And
right.
that makes a difference.
Right. So what kind of information are you trying to get from the history? Are you looking for?
Well, it's sometimes rather interesting, that as they're going through things, patients sometimes have no idea that particular issue was important. Mm-hmm. One patient had a huge host of autoimmune diseases, that one thing after another, and had been to Cleveland, Mayo, Johns Hopkins, and really no success. And as she was talking, she said that, she had gotten an upper respiratory infection, had taken a couple of different medications, and everything seemed to start out from there. And I said, well, have you told that to any people? She said, well, I did at first, and then I stopped saying it because nobody seemed to be really interested. Mm. And that was the key. Mm. It was an interaction and that it was a standard type of thing. It told me the whole cascade of what had happened. Everything fit in. It was a combination of an infection with certain medications, starting a definite syndrome. It was classical, classic textbook situation, and that was the key. It also gave me exactly how to treat it, and we had excellent success. And it was those combination of just those two things that happened 5 years ago that it seemed unimportant to her, but it was the total key to the whole problem.
Well, what did she say? Because no one seemed to care about it.
Well, it was at the beginning she told them, but then nobody seemed to react, so she just kind of forgot it. And I kept on asking questions, take me back, because I really wasn't getting the full. I knew there was something
missing. It's like being an investigator.
Yeah, it's being a detective. Uh-huh. And you're looking for clues, you're looking for statements from people to try to put things together. Then, of course, we did the exams and the lab tests that were associated with that, and everything showed up positive. Mm-hmm. And we started her on some specific programs, and and amazing results. Mm-hmm. But if I didn't put that together, and I had to ask her about 10 leading questions to get back to that. Well, what was it? When did it really start? Mm-hmm. What was kind of a key? Did you happen to have an infection? Mm-hmm. Did you take some medications afterwards? Which medications? And as soon as she said that, it was just like, okay. Uh-huh. Now we understand. Mm-hmm. Now I understand what happened to, when her immune system crashed, the lung problems, the autoimmune reactions. It all started to take place, and then cascade after cascade of one thing collapsing after another. And what they were actually treating her for was about 5 steps down, from the original problem. Mm-hmm. And as we went back to the original problem, treated that, all the other things cleared up. Whereas if you were taking care of just the surface problem, it was a frustrating, and basically all the doctors had said, don't bother, there's nothing anybody can do for you. Mm-hmm. We've tried everything.
And just think about the time she saved by having a thorough history done.
I just wasn't letting her go until I got to the root of it.
Yeah.
I just kept on asking questions, and it took a while.
Mm-hmm. Any other examples of history and the importance of history before we go on to examination?
Yeah, even the family histories. As I was talking to a patient, my family, I was asking about family members and their health and what they died of, and they had died of different things. And I was asking questions about it. Oh, yes, they all had fatty degenerative liver. Mm-hmm. And I'm like, so you had 4 ancestors, and uncles and stuff with that. Well, why don't we get an ultrasound on that and see if that's what's going on? Those types of things can really make a very big difference. Family history. One person in her ancestors had a thalassemia, and she was actually coming in for jaw problems, and there was a whole connection on that, because then there's an enlargement of the bone marrow because of that, which actually kicks off makes you more susceptible to TMJ. And I actually had done a paper on one of her ancestors on one of my researches.
Oh, really?
And some of the
before you even had met her.
Before I had even met her, so I knew exactly what was going on. We treated her, and she'd gone everywhere and gotten that, and we'd got it under control. So I had a complete understanding of the whole scenario. She was descended from one of the Siamese twins, that were way back when. And one of them had a particular case that was actually almost the same as hers. And I had written a paper about that. And so I knew exactly how to work that and got her fixed up.
Oh, interesting.
So, family history can be extremely important. So there's just story after story like that.
When we come back, let's talk about the importance of the examination. Listen to the Voice of Health Radio on your smartphone or tablet on all of the top radio apps available. TuneIn Radio, Stitcher, and iHeartRadio. You can find these apps and more on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. Laughter is the best medicine.
Richard Simmons, see, there's one of the reasons why health food never caught on, man. They had the lamest spokespeople. They had John Denver for grape nuts, Wilfred Brimley, the Jolly Green Giant. These aren't exactly the manliest of men here. The worst is the Quaker Oats man. Now, oatmeal's supposed to be one of the best things you can get your kids to eat, but their mascot's somebody you wouldn't let your kids talk to. It's an old dude wearing a powdered wig and man stockings. If you saw him on the playground trying to talk to your kids, you'd be calling up Chris Hansen from Dateline. You'd be like, what's that in the bag? It's oatmeal. Like, get out of here, creep. I was going to make breakfast. Bet you were, sicko.
Are you frustrated by not getting to the root cause of your health issue? Are you tired of not knowing why you're always fatigued? Are you wanting to say no to toxic drugs? Have you lost hope? Are you just tired of being sick and tired? At the Prather Practice, we want you to know that we have the answers for you. We offer the alternative to the disease care model. We are the drug-free model to health and wellness. At the Prather Practice, we look for the underlying cause of your health problem and not just the symptomatology. Through thorough diagnostics, we find your individual health blueprint for your treatment. Where the disease care model is symptom-based, the structure-function model we practice gets to the root of your health issue. The Prather Practice is the most comprehensive wellness center in the Midwest. Our integrated practice offers you the most treatment options to restore your health and your hope. Learn more about the Prather Practice by calling 317-848-8048 or learn more on our website at thevoiceofhealthradio.com.
Doctor, give me the news. I got a bad case of loving you. No pill's gonna kill my head.
I'm Lisa Prather, and you're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where we get to the root cause of your health issue. We're talking today about the importance of the history, exam, and diagnostics. And Dr. Prather, we've spent a lot of time talking about the history and how important that is. Kind of an investigative work, and
Sure.
I can tell that gets you excited.
It does. It does. I finding out what's the underlying problem. It's challenging. It's always fresh, and it's different for each individual. So there's always an interest and a pique, and if I wasn't doing this for a living, I would do it sort of as a hobby. It's such a rewarding type of situation to be able to do what you love, what you really enjoy, and you find challenging. It keeps you young, keeps you interested, it keeps you getting up and going to work and not dreading it. Because you never know what new and exciting things you're going to find.
Right. Well, let's talk about the examination. Why is the examination so important?
Well, we get from the history where we find out where we're going with everything, and then with the exam you confirm it. So you go in there, and I already have an idea that the gallbladder might be a problem, and then I go in there and palpate the gallbladder and can find it. And it's sore, tender. I can feel the spasm around there. Then we do the lab tests and the other different types of diagnostics to find out for sure. But the exam, that really helps us to narrow it down. Matter of fact, we have an MD and a nurse practitioner in there, and they love to see me do an exam. Because they're like, you can find out more things, that we never even thought you could.
By touching the patient.
Yeah, one of the things is I had a mentor, one of my mentors, Joe Maynard, said that the best tool that a chiropractor has is his hands for touch, because you can determine so much of that. And that's one thing that has been lost in especially in the medical schools, is touching the patient and finding out what's happening. Because I can go through and do my examination and basically find most of the issues. I can also prove it to the patient that that's an issue on what's going on. And I've been teaching, the examination to MDs and nurse practitioners too, and they're finding it extremely helpful. Getting in there, really getting the touch in through there, I can tell exactly whether someone has a liver problem, gallbladder problem. Yeah, is it the ascending, transverse, or descending colon? Is it the small intestine? I can feel the kidneys and whether they're inflamed, dropped, the whole spine and what's going on. The muscles, the knees, I can just go through and feel all of that and understand it and know that there's a problem. And it's really, then we go and confirm it. But the examination, it can just show up so much on what's going on the patient. And
I remember you telling me about your training when you were in college, with the hair and the telephone pages.
What Joe Maynard did is he had us get the Atlanta phone book, and he would put a hair in there, and then we had to be able to tell where the hair was. And we passed when he could put it in the middle of the yellow pages of the phone book and then draw exactly where it was. And we could fill it on either side.
Wow. And that was just training?
It took 2 years. So, and he told us it would take 2 years to be able to do that. But it was just training on touch. And so I can put my hands on people and basically tell what's going on. Oftentimes even better than the imaging.
Wow. Yeah. Where it seems like we tend to go right to the imaging.
Yeah, and when we do the imaging, we know exactly what we're going for too. We're not just exploring around. We know where it's going to be, what I want to look at, and I know what the results should be coming back.
And it's nice you mentioned the MD, the nurse practitioner, you as the chiropractor, the acupuncturist. You're collaborating on the examination.
Absolutely. It's not just one person doing an exam, but we're rechecking different things, different aspects of that, sharing, what we're finding, and making sure, because, more than one opinion on something is always a positive thing. And we all have different ways of looking at issues.
And it's important the patient does get in a gown. I've noticed a lot of places, people aren't getting gowned, anymore. But that's very important, right, to be able to do the examination.
You need to be able to get to the spot that you need to look at. Absolutely.
So after the exam, what can people expect?
Well, at that point, usually with the examination, I can actually say, oh, you've got a problem right here, and people said, oh, yeah. So there's a great feedback.
Or when I go in to go over what's being recommended, how did he know that? That's what I hear.
Then what we do is we talk about what lab tests are going to need to be done, what further testing, range of motion, those types of things, imaging, so that we can confirm, make sure that we know exactly what we're doing, and then also have a baseline to see if there's been, if there is progress or loss. And that's one of the things that's important, as we document the examination or any of the testing that's going on. Not only are we trying to find out what the problem is, but we're also trying to measure improvement. So these third-party types of tests are good ways to see if we're making the progress that we should be, because it's not always clear to the patient, or, you need to have a third-party type of thing, because not until the whole thing's actually solved, do you get the changes oftentimes in symptomatology. But you need to make sure that you're going in the right direction. If you're not, then you need to reevaluate and reassess and then start a new program.
Now, before you do your chiropractic adjustments, do you require x-rays?
Well, there are exceptions to that. Children are extremely, and pregnant women are extremely easy to adjust. And it takes, if we do have a situation where it is a not x-ray, we're not going to take x-rays, it's all light, reflex type of adjusting. But any type of manual adjusting, any type of neurological situation, yes, we do. We do want x-rays because it has a huge effect on how we adjust. Because we need to know, one, is there any pathologies that we need to be aware of? Are there any types of, special biomechanics that are going on? It's just like we recently had a patient who came in and said, actually came in for acupuncture, and I was saying, acupuncture is going to be real helpful, which it was. I said, we really need to get some x-rays and see what's going on. Because this is something that definitely needs an adjustment to be able to get you where you need to be. So, well, I've gone to 4 different chiropractors and said, I really hurt afterwards. And I said, well, we'll need to do some x-rays first and see exactly what was going on. I said, what did they find on the x-rays? He said, well, I didn't get x-rays. And I said, and you hurt afterwards? And he said, yes. And so we took the x-rays, and he had a spondylolisthesis of L5 with a grade 2
and what does that
anterior.
mean?
Well, anyway, in other words, he had a fracture in there where things had slipped forward. And the type of adjustment that was being done on him was completely contraindicated for that care. So it's like, yeah, I bet you did hurt. There's a specialized adjustment for that. And we did that adjustment. And he got up and he goes, oh my gosh. So I didn't even know I could feel like that again.
Wow.
And it was after the first time.
And if x-rays had just been done,
that would have been very evident, and they should have known that you shouldn't be doing that particular type of adjustment, that there's a specialized adjustment for that. So we did the adjustment, and he couldn't believe it, and he's been coming back, and he says, I feel so amazing. And I said, now that's what you should feel like with chiropractic. Our patients don't feel worse. They can tell a difference immediately.
Right.
And it's because we know exactly where the misalignment is. We know how to put it in, and we get it done.
Well, let's talk about, how thorough, because you have specific x-rays, especially for the neck area. People say, well, I got x-rays here. Can I use them? But...
And we look at them, and it, oftentimes they're not adequate. So we need to take our own. We have our x-rays also read for pathology by the gentleman who wrote the textbook, that is usually used in radiology. And, he said, you're in the top 1% of the x-rays that we get in.
Just the quality.
The quality. He said, if everybody had x-rays like yours, my job would really be so much easier. So, it's gratifying on that, and, we really try to go above and beyond what's required and really get what we need. So it's important to be able to read them, to make sure you understand all the pathologies, and we really do a very thorough job on that.
Okay, well, we have a couple more minutes in this segment. I just want to make sure that we're talking about x-rays, as far as other diagnostics, real important. And if people have been a radio listener for a while, they know. But lab tests in our office, especially blood work.
Right.
And why is that so important?
It tells you more about the human body and the function of what's going on and the physiology of anything else. So, blood work. I'm a vampire. I love blood work. It tells me so much. I know exactly what's going on in the system, and I really try to make sure that there's no doubt about where the problem is. I mean, it tells me exactly not only what's wrong, but what I need to do to fix it. I have patients who came in and said, I've been everywhere. Why is it that, you had such better results? And I look at what was done before, and I look at what we did on the lab test, and it's, I'm cheating. It becomes a slam dunk at that point. Mm-hmm. So blood work, I love blood work. It tells me so much, and if I know what's going on, I know how to fix it, and then I know how to check it and make sure it's fixed, and it makes things much, much easier. And a lot of the patients say, well, you're kind of a wizard, and it's like, I'm a cheating wizard. It's like I have some glasses and I can see what's, the cards are. Even though the cards seem to be face down, I can see them.
Yeah.
And that's what blood work does.
Yeah. Well, up next, we will be hearing from a patient of the Prather practice who has a very inspirational story to share with us. Never miss an episode of The Voice of Health so that you can stay informed and empowered about your health. Get a podcast of our show automatically delivered to you every week by signing up for our show on iTunes. You can find that link on our website at thevoiceofhealthradio.com. And don't forget, thevoiceofhealthradio.com has complete archives of all of our past episodes with an audio library of information to help you add more life to your years and more years to your life. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice. What is ECP therapy?
ECP stands for External Counterpulsation Therapy. And just to put it into a nutshell, ECP is an aerobic exercise machine. Now, you sit there and say, well, why do you need an aerobic exercise machine? It is the number one treatment for cardiovascular disease. If you look at the research and want to find out, well, how do I fix my cardiovascular disease, whatever it might be, always within the scientific literature, aerobic exercise is one of the most proven, most effective means of reversing cardiovascular disease. So, but the problem is I have people who I sit there and I look at them and I say, well, what do I do about this problem that I have, Doc? And I said, well, go out and run 5 miles, every day. And of course they all laugh because it took every effort that they had from going to the waiting room into the exam room,
Right.
And they're out of breath. So that didn't work. So what was actually done was develop a machine that actually simulates the effects on the body of aerobic exercise, and that's where ECP comes in. And what occurs with ECP is that there's actually a second heart kind of put into the body. Mm-hmm. It's on the outside, but as the heart goes into relaxation, that's when it actually gets its blood. So what we do is we actually have blood pressure cuffs around the legs. It presses on the legs, and we get a huge amount of blood that goes back up to the heart. And the heart is very regenerative, and you get about 10 times as much oxygen with this particular type of treatment than what you normally would. And you get a regeneration of the heart. You also get a cleaning out of the arteries, and you actually get a huge amount of changes in the whole physiology of the body. So all the benefits of aerobic exercise are actually found in ECP, which are absolutely the number one way that you can be able to reverse cardiovascular disease, diabetes, and many other problems.
Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope. You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where our mission is restoring hope to our patients. Well, I have Ben here today. Good morning, Ben.
Good morning, Lisa.
And we asked you to kind of tell your story, to the listeners out there. It's a very encouraging story. And, first of all, what brought you into the Prather Practice?
Well, actually, I'm a South Sider. I'm from Greenwood, and I had some friends that had come
We won't
up
hold
here.
that against you.
No, thank you very much. But I had some friends that came up here, and I'd heard about actually the depth of your blood tests. And I hadn't been to my medical doctor in a few years, and I really felt like I wanted to have a blood test just to kind of see and gauge exactly where I was health-wise. I knew I wasn't very healthy, but I came up here mainly for that reason. And when I came into your office, I noticed the advertisement about the weight loss the practice that you have now.
Okay. So you came initially, for your overall health.
Correct.
And then you saw the weight loss. Was that something, was weight loss important to you?
Well, obviously, yeah, I was at the highest weight I'd ever been in my life. And so I knew that I needed to do something. And so I came up here to get a blood test to kind of get a baseline to move forward with exercise and other diets I came up with or that I would find. But then I was able to talk to you all about what you had to offer.
Great. Well, let's talk a little bit about your experience then through that. You've been coming for how long now?
Started back in March.
Okay. So 4 months? It's been 4 months.
Yeah,
Great.
so originally came back in March. Actually started the diet right after Easter, so around April 12th.
Good. Tell us a little bit about the diet and what kind of results you.
Well, it was I'd never heard of it before, HCG diet, and what it all entailed. But my results have been great. And in just a little bit over 2.5 months, I'm down over 60 pounds.
Wow, that's got to be encouraging.
Oh, it is. It is. I mean, and I have a ways to go. I'm not at the end point yet, but gosh, my energy level's up. My breathing's easier. I just bending over tying my shoes. I don't get out of breath. And I've just noticed a huge, really, just an increase in energy and my appearance. My clothes are a lot looser. So it's all positives. Positives.
I remember when it was pretty quickly you had changed your belt.
Yes.
Yeah. the hole you were using.
Yes, exactly.
I remember that.
That's true, yes.
Yeah, you've celebrated a lot of just great results, you know. We've been in this room, celebrating. I've been teary-eyed just on what you've accomplished. It wasn't... you've lost 60 pounds, 2.5 months. You're now into the phase 3. There's 3 phases to the HCG.
Right.
And now you're in the maintenance phase, although you've been losing some even on the maintenance phase, which is nice.
Yeah, been very pleased about that. It really scared me coming off of the HCG, how I would, my body would react and how I'd go forward. But part of the diet also, it just helps reset your system. It helps reset your whole thought about food. Yeah. And that has been a huge change, not just the physical, but the emotional and the mental side of it, to where I'm just thinking healthier. I'm thinking what's better for me, other than just trying to fill a void. What's better for my body overall.
Yeah. What things have you noticed? Like you've told me when you go to the grocery store.
Oh, yeah.
Yeah, you used to grab
Well, yeah, I mean, late night eating, I would grab a Hostess or a chocolate milk, or I'd eat some pizza. I mean, late night eating like that. But really now, instead of going through the drive-through at McDonald's or Burger King, I'll stop at local health food store or a grocery store and get some chicken breast and an organic apple or two. And that's my lunch. And so it's quite a bit different. I park further out in the parking lot now. I think about walking more, exercising more, and just again, it hasn't been hard. The diet itself is not hard, but it really comes down to a daily, almost meal to meal plan. Because we can eat so unconsciously. Yeah. You sit in front of TV and you eat a bag of potato chips, or you go through the drive-through and you buy what's cheapest, the 2 for $5 special,
the mega sum.
Exactly. And so when on this diet, you really start to rethink, what's better for my body and healthier and long term. Plus, I have my first grandchild on the way in October, and that really kind of set things in motion to really make me think, man, I want to be around, a few years for this child.
Yeah. You're going to have to be able to keep up.
That's right. That's right. Absolutely.
Yeah. Well, exciting. Well, let's talk. Now you're in phase 3.
Right.
And you've made some decisions with exercise. Let's talk about that.
Okay. Of course, in the early phases of the diet, they really suggest, no strenuous exercise, but walking is promoted. And I was doing between 8,000 and 10,000 steps a day with my trusty pedometer. I've not been without my pedometer since March, but really in phase 3 now, I feel like I need to pick up the exercise, and so I go to church on the south side, and we have an athletic facility, and so we have a bicycling or a spinning class that I have become a part of just in the last few weeks. We have racquetball, and some other things like that. So I'm really looking to, now that I feel better, I'm looking to pick up the exercise along with the better eating to help me keep losing as I go forward toward my goal.
Yeah, I'm just so proud of you and the changes you made, and
appreciate that.
I remember one of our first sessions, you were talking about fast food and how many times you would go.
Oh yeah, I'm in outside sales.
Yeah.
And so from breakfast to dinner, I am, all over the city, all over the state.
Yeah.
And always thinking about the next appointment.
Yeah.
And so I'm often thinking, I'm going to slide in here at noon and get something, or slide in before this appointment and get something. And now that I've keep things on paper and have kept track of my food, the amount of food and the types of food that I was intaking was kind of scary, to be honest with you.
Yeah.
Pretty scary.
Yeah.
It really was.
I know you've done some supplementation also.
Absolutely, yes.
And has that helped also?
It has. There's no doubt about it, especially coming here to the Prather practice, and having the weekly support, the assist with supplements, the encouragement, obviously the HCG. It's the whole package that really has given me success. And it is my decision making too when I'm out there on my own, knowing what's best for my body and trying to put that in, but then also having the support of you all has been phenomenal.
Well, if someone's out there listening, and they've been wanting to lose weight or get healthy, what would you say to them?
Well, and I'll be honest with you, I was over 400 pounds, and I looked to, I'm trying to lose between 180 and 200 pounds, and so, 62 pounds or plus is I'm on my way, but not at my goal.
Right.
My situation was I could not look at a diet and only think about losing a pound or two every 2 or 3 weeks. It was just going to take too long. I needed something that would give me a boost and get me going on my way to a healthier life. And if you're thinking about diet, especially thinking about surgery, I had a good friend of mine, a physician, who was really pushing for me to have gastric bypass surgery and to do the whole evasive remedy that so many people are doing. But after talking to some people about that and looking at that, that's just not something I wanted to do. I felt like I should have enough self-control and fortitude to do the right thing. Well, this diet plan that you all have laid out, the HCG diet plan, has just really given me the tools I need to be able to move forward. And I have no doubt I'll reach my goal. It may take a year, may take a year and a half, but I know I've not had any setbacks. Every step has been going forward.
Yeah.
And so I would definitely encourage anyone to at least look at it and see if it's right for them.
Yeah, I mean, you even had a big family reunion during this time.
Oh my goodness! Well, May and June, you're talking weddings, you're talking graduations. We had a
You went
family
through the
reunion,
roughest time.
and I just looked at the dessert table and I just ate some grapes, had some fruit, and moved on. And you know what? Yeah. It would have been nice to have some cobbler or a piece of pie or whatever, but I know right now I'm sort of rebuilding my house and rebuilding myself, and I can have that later. But the fruit and the meats that we had and the salads, I just know it still tastes wonderful, and I feel better knowing that it's better for my body. And I don't have that guilt afterwards.
Yeah.
And that's the thing. It just, to be able to do that has been wonderful.
Wow, so proud of you, and
Thank
I know
you.
You're going to reach your goal.
Appreciate that.
Thank you.
Thank you, Lisa.
The Prather practice is located at 8902 North Meridian Street on the north side of Indianapolis, just south of the I-465 loop. If we can help you to achieve better health, we'd love to hear from you. Connect with our office at 317-848-8048. That's 317-848-8048. Join us again here next week or anytime on our website at thevoiceofhealthradio.com for The Voice of Health with Dr. Robert Prather.